Welcome, everyone. Today's session is on decoding Medicare, how to read your annual notice of changes. And this session is jointly hosted with our Medicare expert, Scott Matthews, co-founder and CEO of Keen. Thank you all for joining us today.
Thank you, Angela. Um, well, really excited to be here. There are a lot of changes coming to Medicare in 2025, and this is the time to start thinking about those so you can be prepared to make great decisions going into the new year. I'll start with a little bit of background, kind of 101 to ground everybody. So, what's coming up is what's called the Medicare Annual Enrollment Period. And it's the one time a year where all beneficiaries can enroll in or make changes to a Medicare Advantage plan or prescription drug plan. If you have a Medicare supplement plan or a standalone dental vision plan, those are not on this schedule. Those changes could be made anytime, but the big, enrollment season is this window when you can make changes to your Medicare Advantage plan if you're on one of those, or a prescription drug plan if you're on one of those. The schedule for this is as follows. Um, October 1st is when the government is releasing the details of the 2025 plan. This is the first time that a licensed Medicare agent like myself or somebody on our team can talk about the 2025 plans. So October 1st, coming up next week, is when the details of the new plans are coming out for all the plans across all the insurance companies. Enrollment into those plans can start as early as October 15th. And so that's the first date where you can apply and enroll in a plan for January 1st for 2025. And that enrollment period goes from October 15th all the way until December 7th. December 7th is the last day that you can enroll in a new plan for 2025. So just keep that window in mind. There's one other deadline that comes before all of this, and that's why we're here today, is that the government requires your health plan to send you a letter by September 30th, which tells you about the changes to the plan you're on now and that will take place starting January 1st, 2025. And this is a very, very important notice. And that's what we're going to talk about today, is how to understand what changes are coming to your specific plan in 2025. And the only exception to that is if you're in a plan that is terminating, instead of a notice of change, you will get a termination notice. And so you should be on the lookout for that. But most people are going to receive a notice of change. Although this year there's so much change, there are probably unusually high numbers of plan termination. So this is definitely a year to be very aware. Now, what's going on in Medicare that is driving so much change? I'm going to put this in really simple terms, but yet I would say this year there are historic levels of changes coming to Medicare plans, specifically Medicare Advantage plans and prescription drug plans in 2025. On the left-hand side, what's driving all of this is a bunch of positive changes that Medicare has made for consumers generally. Uh, Probably the biggest change is changes that are being made on the prescription drug front. There were a bunch of new rules passed as part of the Inflation Reduction Act, which happened a few years ago. You may have heard things like $35 insulin, or Medicare is now negotiating for high cost drugs with pharmaceutical companies. The high cost drug negotiation pricing actually doesn't go into effect till January 2026. But one of the biggest things that's going on this year with the drug changes is the max you would have to pay out of your own pocket for drugs is going from $8,000 this year to just $2,000 next year. So there's $6,000 more expense that's getting moved effectively on to the health plan. There's going to be a lot of changes besides that to the drug plans, including things like payment plans that are going to be available. We're going to do a separate webinar just on the changes to the drug plans because they are so compelling. But this change of the drug plans and the cost is a really positive for consumers, especially consumers who use a lot of medications, use a lot of expensive medications, but it does increase the cost pressures on the health plans. Um, there are other things that are new this year. Medicare is requiring health plans to have more coverage for behavioral health. It is providing more protections to consumers when they want to appeal a denied claim or a denied pre-auth. They now have an independent third party to do that appeal to. That's and there have been new regulations to uh, reduce overbillings of Medicare. Um, there's also new rules that say that mid-year consumers should get a notice about what benefits they haven't used yet, so they can make sure they're aware of all the benefits in their plans, so they can have a fair chance to use those. So there's a lot of positive changes coming to consumers on the left-hand side, but all of these changes are increasing the cost pressures on plans, and that's going to be reflected in what they can offer this year. Um, we know that in 2024, for the 2024 plan year, a lot of plans increased their benefits. They offered very rich benefits for 2024. And a lot of plans um, have announced very publicly that because of that and because of increased utilization of those plans, uh, they have in some markets lost a lot of money. And so there's a lot of the big insurance companies who have already announced that because they are losing a lot of money on the plans they sold last year, they're going to have to pull back some this year. They are going to have more costs associated with its drugs. They're going to have less ability to deny claims, which is going to increase the cost. They will have higher administrative burden for some of these programs they have to uh, administer now. And the funding for 2025 was an increase, but it was below inflation. And so sometimes people will say they didn't get as much money as they were hoping for 2025. So there's a kind of a perfect storm of a lot of things going on in Medicare, which all result in when the plans had to come up with the 2025 plans and they wanted to sort of balance their budget, they had to make a lot of changes to those plans. And a lot of those changes that are coming to the plans are, I would say, unusually significant. And that's why this is a year where everybody should be, on the lookout. Now, like I said, the notices that you're going to be getting about these changes, they don't directly impact Medicare supplement plans. But if you're on a Medicare supplement plan, you should know that we have seen for Medicare supplement plans in the last year record high year-over-year increases in many plans. I spoke to somebody last week who had about a 30% increase in their Medicare supplement plan. And we were actually able to shop that plan and save them close to $200 a month. So um, if you have a Part D plan and a supplement plan and you're on that path, we're not going to talk about that as much today. We're not going to talk about supplements as much today, but I do know that if you're thinking about your total cost going into planning, you should understand what that cost is going to be, and if you haven't paid attention in a while, to make sure you check to see what those premiums are going to be on the supplement side. So, as a result of all the cost pressures on the health plans to deliver more benefits and more consumer protections, we are going to see significant changes to plans this year. Some plans are going to have premium increases. Some plans are going to have a drug deductible where they didn't have one before, or an increased drug deductible. And this means that when you're getting your prescriptions filled at the pharmacy, before your benefits go into effect, you have to pay a certain amount of money first. We're going to see an increase in your maximum out-of-pocket costs for medical. Just like we are seeing a decrease in the out-of-pocket maximum for your drugs down to $2,000, every Advantage plan has a max out-of-pocket for drugs or for medical costs, and you're going to see that increase in some cases. There are going to be plans that have higher primary care copays and also specialty care copays. And some plans are going to have increased hospital copays, whether that's the number of days or the amount you have to pay per day. And really important this year is to make sure you understand for the medications you're taking now, are those medications still going to be covered in 2025? A lot of plans are no longer going to be covering as many medicines as they did before, and you really have to look in the fine print to make sure that your drugs are covered or not, and if they're not, understanding what you need to do to work with your doctor to maybe switch the drugs you're on or file an appeal. But that's going to be a big one this year. Um, what your medications cost, that cost sharing is likely to be different. And then we are seeing a lot of changes to the provider networks themselves. So you can't assume going into the new year that your plan that you were on covers the same doctors or covers the same drugs. There are a lot of changes, and it's important that everybody shops. And this is what your annual notice of changes is about. Your annual notice of changes is a letter you get from your health plan. And by letter, it can be a physical letter mailed to you, or it can be an email that you get. If you've signed up for electronic communications for your health plan, it's likely to be an email. If you get paper copies, you're going to get something that looks like this in the mail. And so today, what we're going to do, and then these documents are somewhere between 20 and 30 pages long. They look a little bit intimidating, but the goal of today is to walk all of us through some actual change notices so that you can see exactly how to read them, how to interpret them, and what to do and when to do it, so that you're really well prepared for the annual enrollment season that's coming up. Now, I'm going to ask a question of all of you, and then you could put the answer in the chat. I'm just curious if any of you have received your annual notice of change yet. Yes or no? Feel free to just put it in the chat. I'm curious if you guys have seen it. They usually come the last week of September. We've heard that some of them are starting to hit. So this is something and I'm seeing it looks like we have a few not yets in the chat. So this is something you're going to want to literally be looking for this week. It might already be sitting in your email box if you get notices from your health plan or in your health plan portal. But this is a year where they typically wait till the end of September. The deadline is the 30th, and we're getting very close to it. So do be on the lookout. Okay, it looks like nobody so far has seen it. So be on the lookout. This is a letter. It is very important. This year, it's more important than ever. And on an annual basis, probably half the people never look at this. So that's maybe okay on a year where there's not much change. This year, every single person needs to find this letter, read it, understand it. And I thank those of you who are on the call today, because I would also encourage you as we learn how to read this letter, that you also make sure you're telling your friends, your family, your loved ones to be aware of this, because most people are not aware of the changes that are coming. Most people are really not that aware of this letter and how important it is. That's why we wanted to take the time today to spend the time to go through it to help you understand how to know what changes are happening in your plan and then what you can do about it. So what I'm going to do now is actually going to take you through some examples of actual change notices, and we're going to walk through how you read a change notice. I'm going to take in today's example, I'm going to go through a Medicare Advantage notice because they're a little more complicated. The prescription drug notices are similar, they just have less pieces to them. If you have received the notice or find it in your email and you want to follow along with it in particular, that's great. What I'm going to do is I'm going to show an example of a notice from last year that was for the 2024 changes. So this is not but they follow the same pattern. And so what I have here, which I'm going to show you, is a few examples of these notices. I've got one here from United. United is the #1 Medicare Advantage player. I've got one from Humana. They're very highly up there, and also we've got one from Aetna. And what you'll see is that all notices of change, they follow the same exact pattern. The reason they follow the exact pattern is because the government dictates what needs to be in them and gives the health plans essentially a template for how they should write these. And you can see this one from United is a 26-page document. This one from Humana is a 32-page document. They all follow the pattern of this. This is the template that the government actually gives people to follow. So you can see the government wants you to say these lines, and you will see, they say, ask which changes apply to you. Think about whether you're happy with our plan. Well, that's what they end up saying in these notices. Ask which changes apply to you. Think about whether you're happy with our plan. So just know this notice is a standardized notice. It's standardized by the government. Each health plan will put the very important details about the plan you're on in this notice. So I'm going to walk through the United notice. We may look at a couple of the other ones, but since United is the largest health plan in the country, this is the one if you're on United, you're going to get. And as we go through it, just please submit any questions in the chat. And as I go through it, what I'm going to do is I'm going to use this as a way to kind of explain what some of the major changes are coming this year and where you're going to find them. So let's go through it. We're going to go through a live real world example here. And like I said, if I use a term that is not familiar to you, put it in the chat and I will make sure I define it. And if you just have something you're curious about, let me know. Again, you're going to either get this as a paper copy in the mailed to the address you have on file with the health plan. So if you've moved, you got to make sure that you're tracking that down, or it may be emailed to you if you signed up for electronic documents from the health plan. If you don't get it by September 30th, you should look at the number on the back of your member card and give your health plan a call and make sure they're getting a copy of these changes to you. So we're going to look at as an example, this is the annual notice of changes for 2024 for a United AARP Medicare Advantage PPO that happens to be in the state of California. Your notices are going to have the 2025 on them. So that's what you're looking for. You're going to be looking for a notice of change for 2025. I'll scroll down a little bit. You'll often find helpful information on the cover page, who to call for help, both phone number, website, and so forth. Everybody does their cover pages a little bit different. The second page of the United one is a bit of more hopeful information. We're not really into the meat of the document yet. But one thing that's really important to note, what it's saying is there are changes coming and they are going to have a new provider directory. That's a list of doctors that are covered under your plan, which doctors are in network. There's going to be a new pharmacy directory coming, and that's a list of pharmacies that you can go to. Sometimes there are pharmacies that have a preferred tier where you get a better price. And so there's going to be a directory of those. And then there's very important going to be a drug list. And this is, for this year, one of the most important things is to look up the drugs that you're on now to see if they are covered or not covered, and then what coverage tier they're on, which will dictate how much you pay for them. But important to note, the documents are not going to be ready until October 15th. So one of the things you, as you start reading this note now, know that around October 15th, you will then be able to actually go and pull the pharmacy directory for 2025, the drug list for 2025, the provider directory. If you look at it too soon, you may be looking at 2024 and you don't want to do this. And this is unfortunately kind of a complicated piece. You have to navigate their websites. You have to find these documents. Luckily, as Medicare advisors, we have tools where we already have all this data in one place. We can look this stuff up very quickly, but I appreciate that it can be a little bit cumbersome for consumers to look this information up. The other thing that will really spell out how your plan is going to work in the new year is the evidence of coverage. The evidence of coverage is a 200 to 300 page PDF that spells out in detail all the coverage that are in the plans. And generally that's good to have as a reference when you're trying to understand a particular situation and how the plan works. But the point is that to really understand the full extent of the changes, you're going to have to read these additional documents to look up your doctors, your pharmacies, and your medications. And these additional documents are generally made available by October 15th. So they're not quite ready yet. And you don't want to, despite what you're going to learn in the letter initially, you're not done until you've done the research on those three things as well. So let's skip down, and then what you'll see here is really the first page. It says, here's what you're enrolled in now. And here's what you should do. And this is a good checklist. So if you're just trying to get oriented to the process, it's a nice checklist. And it, take your time to go through this. You will, it will say, look, read the benefits and the cost changes to see if they affect you. Look up changes to the costs for expenses when you see your doctor and at the hospital. Review the changes to the drug coverage, and think about how much you will be spending in the next year. Make sure you look up the drug list. Even though that document won't be available for about 3 weeks, make sure you get that. And then make sure that you confirm that the doctors, specialists, hospitals are going to be in your network, and pharmacies are going to be in network the following year. And then, think about whether you're happy with that or you want to research other plans. So again, this is what the government asked the health plans to suggest to people. And then they give you some suggestions on how you can compare your other options. Now, the document lists Medicare.gov plan compare. What they don't mention, but they should, is that website, Medicare.gov plan compare, will not have the 2025 plans until early October. So they actually are telling you to go somewhere, but you won't actually have access to the new plans to do that comparison until early October. And then you can do that. And then you can, they suggest you go to if you have a preferred plan from that, you go to the plan's website to learn more. Of course, this is a lot of work. There's a lot of plans out there. There's a lot of complexity, a lot of dynamics for your market. And so this is also exactly what you can get as a service from a licensed Medicare agent. This is what we do every day, make this easy and simple for people. And I see a question from Juliana. Should we read the Medicare and You 2025 booklet you received? The Medicare 2020 and You 2025, Medicare and You is always a great resource. It has the answers to most basic questions on how Medicare works. What are the parts of Medicare, how Medicare works, what are some of the major decisions. It's a foundational document. It also talks about what your rights are and how you can appeal and do things like that. It's not going to talk about the changes to your plan for 2025. It will probably talk about some of the general changes in 2025. So it's a good reference to always have on file. and it's something that I always recommend people take a look at, thumb through, and use as reference as well. So it's a good document, but but the document that's going to tell you the changes to your plan will be this annual notice of change. And then it reminds you the dates, of course. You have until between October 15th and December 7th to switch plans if you choose to. And then there's some standard disclaimers and information about the plan. Then you get to the table of contents. So we're 6 pages in, and now we've gotten to the table of contents. The summary section, there's always a summary section at the beginning, and that's the fastest way to understand what your major changes are. And there's a couple optional sections up in front. So if the name of your plan is going to change, the plan name, it will be section 1. If your plan is changing and you're going to be automatically moved to a different but similar plan, that's going to be another upfront section. And in this case, they have both of these sections because in 2024, this plan name did change and they were automatically enrolling people in a slightly different plan. If neither of these things are happening, then section 1 will be this section, which is changes in benefits and costs for the next year. So this is the meat of it. And so if you're reading this document, the most important sections are the summary and the changes. Now, if you are for some reason not going to be moved, if you're going to be, your plan is terminating and you're not going to be automatically enrolled, that's something you'll definitely want to take note of, because that will be happening a good bit this year. And then there's information about a lot of other important resources. But the most important thing to know, if you're trying to find out, I want to quickly understand what changes, what are the major changes that are impacting me. It's this summary. So you look for the summary of important costs, you see what page it is, and you go to that page. So this is where you're going to start finally seeing the big changes that are going to impact you. It's the summary of important costs table. And just to show you, if I go from the United, I switch over to the Humana, you see the exact same summary of important costs table. So they all have it. It's the most sort of the quickest way to get the most important information. And it's an upfront section, and it lays out in a glance what the changes are. So I'm going to go through these one by one. I'm going to define the terms, and as you're reading this on your own, this is where you're going to see what changes may be impacting you in 2025. So the way this lays out, there's a column here on the left, which is this year, and the column on the right is next year. So when you get this document, it's going to say 2024 here on the left, and the difference is going to be 2025 here on the right. So let's go through some of these big ones. The monthly plan premium. So this is the amount you pay each month for the plan. This is in addition to if you pay a Part B premium to the government, or it's taken out of your Social Security check. In addition to that, this is the amount you pay the health plan every month. And we are seeing in some cases this go up. Health plans generally are trying to preserve $0 premium plans. That's something that consumers really demand. But if you were on a plan with a premium, you want to pay close attention to see if that premium has gone up. Sometimes zero premium plans do have a premium added. If you see a premium go up or have a premium added, that's a pretty strong signal that that plan is they know if they're increasing a premium from 0 to something else, that is going to cause consumers to shop. And so that's a pretty strong signal that you're going to want to be thinking very carefully about your options if you see a premium increase. Annual medical deductible. The annual medical deductible is the amount you have to spend out of pocket before the before the medical benefits of the plan kick in. So for example, if you have a $500 medical deductible and you go see the doctor because you're sick, you may have to pay the entire amount of that visit because the amount you've paid for the year is less than that $500. Now, that deductible won't apply generally to preventive services like an annual wellness checkup or getting a flu shot, but will apply for medical needs. And so the medical deductible, in this case, it went up from $300 to $400. And so, that is money that's going to be out of your pocket before your benefits kick in. And you do want to see if that has changed going into the new year. The next important one to be paying a lot of attention to is the maximum out of pocket. Now, a lot of people ask, well, what is a maximum out of pocket? And sometimes people get confused between a max out of pocket and a deductible. The maximum out of pocket is the most you will pay in the year for covered medical services. So if you're on a Medicare Advantage plan like this one, you pay as you go. When you go to the doctor, you have a co-payment. When you go to get a lab or x-ray done, maybe you have a co-payment or you have a co-insurance. When you go to the hospital, you have to pay a daily rate for the first number of X days. So you're making all these little payments. If these little payments add up to the out-of-pocket maximum, then you don't have to make those little payments anymore. And so that's what the out-of-pocket maximum. It's just a total cap on what you could spend in a year if you're really having high medical utilization. And what you'll see in some plans this year is that maximum is going to go up. Sometimes it goes down. A lot of times it goes up this year. And so you want to know, if you think about how much you might have to pay worst case scenario for medical expenses, that's what this number is. And so, if that goes up by $1,000 or more dollars, that could be for some people, something you don't have in a rainy day fund. And so that's definitely something to look at. And that's what that means. And that will be one of the top things you look at. The next thing to be looking at here is, what does it cost when you go to see the doctor? You'll see an amount for your primary care visits, and you'll see something for your specialty care visits. Now, right now, we're looking at a preferred provider organization plan, a PPO plan that lets you go to in-network doctors at a lower rate and out-of-network doctors at a higher rate. And so for a PPO that lets you see out-of-network doctors at a higher rate, it'll also show the out-of-network co-payments for primary care visits and specialty visits. And again, you'll want to look at this closely, especially close attention to the specialty visits. Health plans like to keep the primary care visits as low as possible. So you might see more movement in the specialty care visits. And then you think, well, how often do I go see a specialist? And that's going to impact your costs. And so that's one of the important ones to look at. The next section is your inpatient hospital stay. So what are you going to pay if you go to the hospital? And this, you'll see a lot of different plans with different numbers for what you have to pay if you get admitted to the hospital. The way a Medicare Advantage plan typically works if you're admitted to the hospital is you pay a daily rate for some number of days, and after that they cover you fully. Typically it's, you can see this case, this was a $300 daily payment. for the first 4 days, and that did not change from 23 to 24. So you want to look at both the amount per day and the number of days. They could say that it's still $300 a day, but maybe that goes up to 5 or 6 days, or they might raise it to $400 a day. So this is what it will cost, out of pocket when you go to the hospital, and that's one of the these are sort of one of the bigger ticket items. And then what it's showing here is for the first 4 days, you're paying 300, and then for additional days, there's no copayment. That's not always true, but this plan it's how it's designed. Now, since this is a PPO and it allows for out-of-network coverage at a higher rate, you'll also see this chart shows the out-of-network costs, and the out-of-network costs are quite a bit more. And the out-of-network costs, if you go to an in-network hospital, you're going to pay $300 a day for up to 4 days. If you go to an out-of-network hospital, you're going to be paying $500 a day for up to 20 days. So if you have a long hospital stay in this plan, you would probably hit your out-of-pocket maximum fairly quickly, and that's why it's better for your hospitals that you like to go to be in network. And there's definitely higher cost share if you're in an out-of-network hospital when you're in a PPO. But if you often go out of network, you want to look at these out-of-network charges really closely, because they, you could see change from year to year for the 2025. So those are the major pieces of medical. We'll show you where some of the more detailed pieces of that are when we get to it. But then the summary chart, it starts talking about your prescription drug coverage. All right, so that's where you'll see here, Part D prescription drug coverage. And this is what you pay when you get your medications filled. And this is one to pay a lot of attention to. This is where, we're going to see a lot of change, because as we talked about earlier, the max out of pocket for drugs is going from $8,000 down to $2,000. There's a lot of cost shifting moving around. And the health plans have to find a way to make sure the money that's being spent is being spent because it's needed. And so one of the things we're seeing a lot of this year is the addition of a deductible. And so this is probably one of the most important things to look at is, does my Part D prescription drug plan now have a deductible? And what does that deductible apply to? Now, when it comes to drugs, there's this concept of tiers. Tier 1, Tier 2, Tier 3, Tier 4, Tier 5. Some plans have Tier 6. And typically, Tier 1 is your low-cost generic drugs. Tier 2 would be your higher cost, but still generic drugs. Tier 3 is is typically your name brand drugs, but they are the lower cost name brand drugs. And Tier 4 is usually your higher cost name brand drugs. And Tier 5 and Tier 6, those are used different ways. Sometimes Tier 5 would be a biologic. Sometimes they have a Tier 6, which is for diabetes drugs. It really depends on the plans. But you want to know of the drugs you take, for each drug, what tier is it in, because that will dictate how much you pay for that drug. And this is where you need to go look up in the formulary, get somebody to help you look up in the formulary what tier your drugs are on and what costs they're going to be. So what they're trying to do is encourage you to take lower cost drugs, make you pay more when you're taking more expensive drugs. So what you're going to see, if we go back to this tier concept, if we go back to the deductible, what we're seeing a lot is deductibles that apply to tiers 3, 4, 5, and above. So you'll rarely see a deductible apply to tier 1 and 2, those low cost generics, because they want to encourage you to take the low cost generics. But for the more expensive drugs, we're seeing a lot more of deductibles, meaning you have to pay this out of pocket before your drug benefit kicks in. So that's first thing. On the drugs, take a look, understand what the deductible is. Now, beyond the deductible, it's important to know for each of your drugs, what tier is it in, and what tier is it going to be in 2025? And then what is it going to cost you depending on what tier it's in? So this is a plan that has a $0 copayment for tier 1 generic drugs. So they cost you nothing out of pocket. This plan we see here has a $12 copayment for tier 2. And sometimes you'll see things like one price at standard retail and a better price at preferred retail or at mail order, but just be on the lookout for that. Tier 3, this is a case where you see a flat dollar amount, $47. What you might see on a tier 3 next year is that flat dollar amount, which is nice and predictable, go to a percentage. And that's where you have to be a lot more cautious, because a co-payment, which means you're paying $47 a flat amount every time, is something that's reliable and predictable. If this goes to let's say, for example, let's say this went to a 30% co-insurance or cost share, that means you're paying 30% of whatever the cost of that drug is. If it's $100, you're paying $30. If it's $1,000, you're paying $300. So your cost exposure varies with the cost of the drug. And now you have to start worrying about what drugs cost if your plan is moving to a percentage versus the flat dollar amount. So that's one thing to pay really close attention to. Are you changing to percentages? Because that requires a lot more research to understand the cost to you, and that can be significant. And of course, keep in mind that all this is in the context that all these payments will add up to no more than $2,000, because that is your out-of-pocket max for drugs. And that includes the deductible, whatever that is. But just know that if you typically spend a lot out of pocket on drugs, this is all going to be better for you. However, if you don't spend so much, maybe you're spending $1,000 a year on drugs, this could be a lot worse for you, because now you're going to be paying a higher burden of some of those costs. So this is a very personal question for folks, and one to just look at very carefully. And so, like I said, there's a lot of changes coming to the drugs this year. The out-of-pocket maximum is going down to $2,000. They're getting rid of what you may have heard referred to as the donut hole. That phase is gone completely. They are going to allow people to put that $2,000 on a payment plan. We'll have a separate webinar to talk about how that works and the pieces. But there are a lot of changes coming to the medication piece of this. So definitely, if you take any medications on a regular basis, it's important to look this up, especially if you take any medications that aren't generic. That's where you're going to see a lot of impact. Okay.
One question that I received is, with all these different drug tiers, where should folks look up where their drugs fall and what resources are available there?
Yeah. So the document you will tell you what tier the drug is on is called the formulary. And that's a big, long document, and it'll have every drug by name, and it'll say this drug is on tier 4, this drug is on tier 3, and it is specific to the health plan. And so around October 15th, in this case, you can go to the website, and I was looking this up for Humana earlier. They have something called the drug list tool. And so sometimes, this is kind of what it might look like. You can get a printed copy of the drug list. You can sign in and do it electronically, but that's a whole other area of search, and it's a formulary search. And unfortunately, it's a little bit manual to do because they don't give consumers super handy tools, and the process is different a little bit by health plan. But it is very, very important that you get your formulary and you look up those drugs or get some help from somebody who can help you with that, because that's where some of the biggest changes are going to be this year. We've heard that some plans are taking a considerable number of drugs off the formulary and putting on the other restrictions on the drugs. So we've just gone through the summary, but the summary is where, you know, most things are. Beyond the summary, and I'll go back to the table of contents. So we have just talked about the summary. Definitely want to look and read the summary carefully. Now, beyond that, section 1, has another double click on all things. And so if you think about all your costs that you anticipated for the previous year or will anticipate for the next year, if you didn't see it mentioned in the summary chart, then it's a good idea to go down and read and get into a bit more detail in section 1. Section 1 talks about the premium, out-of-pocket amounts, your networks, your costs for medical services, and more detail on the drug coverage. And if you just as an example, section 1 will lay out the premium change and the premium change for any extras you may be buying, like this is like an optional dental plan. Section 2 will talk about the changes to your out-of-pocket max amounts, and this here now shows more detail on the out-of-network maxes because those can be different for PPOs. It talks about where you can go to get the documents to look up your changes to your plan information, and then it will talk about other kind of categories of spend and how those might be changing that are beyond sort of the summary. So what does it cost to take an ambulance to the doctor? It's going from $250 to $300 in the case of this Humana plan. What does cardiac rehab cost? Chiropractic services, dental services, all the other pieces of the plan, the limits, the coverage will be in here. What does it cost to go to the ER if you're not admitted? What does urgent care cost? What do labs and x-rays cost? So this is where, if you have to go into skilled nursing, what is that going to cost? Urgent care here, vision care. So it's going into more expense categories, and this is where, if you have a particular expense category, it's really good to look that up. And so, this is like I said, this is a document that can be a bit intimidating. It's got a lot of healthcare lingo. It is definitely, complicated, but it's also very important to take your time, take an hour to just go through and read it and highlight and circle the things that are changing that you think are going to impact you. It's definitely a good idea to talk to somebody to get help. People who do this every day, we definitely recommend that. But there are a lot of changes coming in the next year, and this document will tell you what those changes are and how they're going to impact you. And we are seeing in some markets big changes. We're seeing in some markets, in some markets we're seeing little changes, but in many markets we're seeing lots of big changes. And the health plans announced there's going to be big changes, and we are seeing that. And so this is your first preview as to what your changes are. As soon as October 1st comes along, you can talk to, we're allowed to start talking about the other plans and all the details and differences. So, October 1st, October 15th is a good window to get prepared and start thinking about what plans might be best for you. But this is this document, hopefully we've helped you decode it a little bit and understand, what it looks like, and kind of how to read it and how important it is to read it. because you really will see a lot of changes this year. And then just, we got a couple minutes left for questions. In terms of next steps, go find that annual notice of change. Be looking for it in your mailbox, in your email. Go through the sections we just discussed. If you have questions, get help. Understand the major changes and how they're affecting you. Please definitely check your coverage for the new 2025 plan with the new 2025 drug formulary, provider network, pharmacy network to make sure that your doctor hasn't left the network. We're seeing a lot of network changes this year. And I think it's always good for you to compare your options to everything else out there. And this year especially, it could not be more important. So that is what we are covering today. Again, be on the lookout for your annual notice of change. Take your time, read through it, look and see, what the major changes are going to be affecting you, and then, make a plan. I will throw
Thanks.
it up for questions now and throw it back to Angela. Marie asks, what is the difference between Advantage and supplemental plans? The way I like to think about it is traditional Medicare has gaps, and in traditional Medicare, if you get admitted to the hospital, you have to pay about $1,600. And then you are on the hook for about 20% of all your medical costs for visits, surgeries that are outpatient and so forth. So there's some big gaps in traditional Medicare, and people choose to close those gaps in one of two ways, either a Medicare Advantage plan or a Medicare Supplement plan. A Medicare Supplement plan is, we haven't talked much about it today, but it essentially is you pay a fixed amount of money every month, and it closes some amount of those gaps up into almost all the gaps you would have in Medicare. The advantage of a supplement plan is it does not have network restrictions. So people who want the flexibility to see any doctor they want would typically like to be on a supplement plan. But and that gives you the most flexibility, but they can be more expensive. Those costs do go up over time. And with Medicare Advantage, you will have, instead of a monthly premium as you do on the supplement, you'll have a low or no monthly premium, and it's more of a pay as you go. So there are different ways of paying. Supplements are a great choice for people who can afford them and want to have the flexibility, especially if they travel or, but it's a very personal decision, and it really depends on the plans in your area as to what's great. Supplement isn't a PPO plan. A supplement lets you see, it's kind of like a PPO in the sense that like you can see any doctor in the Medicare network, which is most doctors, and there are not network restrictions. There are a few hospitals that don't take traditional Medicare, they only take Advantage. That's pretty rare, but you do see that in some markets. But a supplement is is a really good option. And I think anybody who's sort of trying to decide between the two, it really depends on many factors and a lot of sort of personal questions. But fundamentally, they differ in the flexibility to see the doctors you want to see and how much you're going to pay and when you're going to pay it.